Now to a Target 12 Investigators exclusive. Local psychologists say the need for behavioral health services has increased in recent years.
But we found the number of clinical psychologists in Rhode Island has gone down. Target 12 investigator Kate Wilkinson spoke with a doctor on why he's retiring and what he says needs to change.
The cost of doing business has more than doubled since Dr. Peter Oppenheimer started his practice in Barrington in 1994. But he says insurance reimbursement rates are not matching that. And now he worries the mental health system is at risk of collapsing. After decades of seeing patients of all ages, clinical psychologist Peter Oppenheimer is planning to retire. But he would have liked to work longer.
Part of my decision to move towards retirement was that I was looking for adding new staff and couldn't find people willing to do it.
Data from the U.S. Bureau of Labor and Statistics shows there are fewer clinical psychologists in Rhode Island than before the pandemic. In 2019, the BLS estimated there were between about 650 and 750 clinical and counseling psychologists. But there has been a decline since COVID. And in 2022, that range was estimated to be between 410 and 590. Oppenheimer says a major reason for that is insurance. Reimbursement rates, which he says haven't kept up with the doubling of costs that he's seen since he opened his practice in 1994.
When I'm a provider for an insurance company, I have a contract. And in the contract with Blue Cross and United and Tufts and others, it will say that we are obligated to accept the rates they establish.
While Oppenheimer is opting for retirement, he says others are choosing to no longer accept insurance.
We're kind of caught between there's economic viability in that, but we also want to be part of the system to help serve the whole community.
Seamus Durak is a senior attorney and health policy analyst for the Rhode Island Parent Information Network, a local nonprofit that helps people navigate the healthcare system. He says reimbursement rates for mental health professionals are a pervasive issue across the country.
What that results in is something that we would never tolerate in the medical arena, but is all too frequent in the behavioral health care arena, which is providers that do not accept insurance, requiring anyone to obtain services by paying out of pocket.
New at 6, we take a closer look at the laws that already exist designed to make behavioral health and medical coverage be treated equally by insurers and why analysts say that's not happening. With the Target 12 investigators, Kate Wilkinson, 12 News.